Hello, everyone. My name is Ray Ravy. I'm the Vice President of Benefits here at Infinity HR. And over the next several minutes, I will be reviewing some benefits with you. And you're probably thinking to yourself, well, who is Infinity? Infinity is a PEO company or professional employer organization that has teamed up with your worksite employer to not only handle your payroll and taxes, but also offer you a number of great benefits. I have here with me today Jason Ellis, who oversees our education and enrollment center. So, Jason, tell the folks listening at home, why is our process better? What tools will they have during their initial enrollment period to take advantage of these benefits?
Yeah, thanks, Ray. I'm glad everybody could be on today. Infinity has a strong menu of benefits, but the thing that we found over this last year's open enrollment, not a lot of the employees have had the opportunity to really go on and take advantage of it. So we were over the last year able to really enhance the benefit portal that they can go on, very user friendly. You can self-serve model, or of course you can call in or schedule times with our counselors, which are licensed counselors, very experienced, and walk you through each of your benefits. Now, why are the benefits great through Infinity? Well, by pulling from such a large group of the employee population from coast to coast, you're able to get benefits at great price points as well as great underwriting conditions. That means you can pretty much not, if you have health issues or health concerns, you don't really have to go through any kind of medical evaluation to have access to these benefits for the most part. You go on and answer some questions, and you have access to disability, life insurance, and things that we're going to get ready to talk about. So that's some of the strong features of being able to go through Infinity.
That's awesome. Thanks, Jason. So here are a few benefits, just highlight, but we're going to go into these in detail. The first few, which we'll spend a little bit of time on, are what we consider kind of core benefits, your minimum essential coverage, your dental, your vision. But the first one is really the redirect minimum essential coverage plan. What is minimum essential coverage? This is something that the ACA put in place a number of years ago, and it provides all of those preventative services. So if I'm going to the doctor for, my annual physical or age-appropriate screenings, those are going to be covered at 100%. But what's unique about this program is it takes it one step further. It provides 24/7 telehealth and then redirect in the name. If that doctor on the phone's unable to diagnose those minor illnesses, they're going to ask the subscriber or you, which doctor would you like to see? It might be a primary care, it might be a facility. They're going to coordinate that visit for you so you can go and meet with that doctor face to face. Now, some of the other benefit features in this, there's three different tiers, which when you go through the enrollment system, you'll see the options. But the first one is just the baseline coverage, your telehealth, your preventive screenings. The second and third tier also provide a layer of accident and hospital confinement benefits. So if you're confined to the hospital, it's going to pay X amount of days, up to 5 days. So there's some additional benefits built into this. The one thing that we want to reiterate, and it's a question we get a lot, and Jason can certainly, kind of talk to this is not major medical insurance. This is not your United Healthcare, your Blue Cross Blue Shield, where if you get in an accident, you have to have a surgery. It's not going to provide that level of coverage.
Yeah, and that's what we found on our counselors who have been with numerous Infinity employees on the phone. They asked that question: does this function as major medical? And it does not, but it does have value. If you're in a situation where you're not, going to the doctor that much, but you're getting your preventative services, rendered throughout the course of the year, your checkups, exams, screenings, things of that nature, that's where this plan can, really add value and be an economical way for you to, to be able to afford that type of coverage. So that's really the target of it. Correct, Ray?
That is. So, keeping along with the core benefits, the next one is Guardian. Here's a snapshot of some of the services provided, and most of these benefits, when we say things like in network, out of network, know that the best value you're going to get with any benefit that you have, if you're dealing with a network, whether it's an HMO or a PPO, the best value is in network. Certainly go out of network, but as you can see here, it's going to cost you a little bit more. So with our Guardian product, we've got two options. We've got a low and a high option, or a base plan and buy-it. And what that means is, what is my annual maximum benefit? You're going to have a little bit of difference between the preventative care, the basic care, between the options, but this is what is going to be paid in maximum for each participant that's in the plan. So if you have a family of 4 in the base plan, each individual gets $1,000 to go towards those services.
And I was just going to say, I know when many people, many of the Infinity population want dental coverage. And, if you look on your own, you may find some dental, but again, the price points on this dental product are very solid. And again, the Guardian network is very strong. So, you definitely want to take that in consideration when choosing dental. Be difficult to find anything to really compete with this outside of the Infinity benefits that are available to you.
Yeah, that's a great point. And another key feature to this is the max rollover. So if you're getting your preventative cleanings twice a year, you don't use your annual benefit. Let's say I have a balance of $250 from a previous year. That rolls over. So over time, you can accumulate that annual max. But once you enroll, there's a couple of things that you can do to access your ID cards. They're going to be mailed to you within 7 to 10 business days, or you can go onto the website myguardian.com or myguardiananytime.com. They're going to ask you to register, and then you can print your ID card there, check your claims, look for providers and such. The other benefit that we have with Guardian is our vision plan. The network is actually VSP. They're the second largest network in the country. And again, you have in-network benefits, you have out-of-network benefits. It's going to cover, 0% or zero out-of-pocket for things like the eye exams, single vision lenses. It works more as a reimbursement if you do go out-of-network, where you would have to pay it up front. You submit a claim, you get reimbursed. So again, going back to what is the advantage of an in-network versus out-of-network, it's simple. The discounts are applied in network at time of service, and then your out-of-pocket is much lower. So, Jason, do you have anything to add on the Guardian?
No, I know one question we had, and this may be added to this, is the contacts are also included with that.
Yep.
I think that's also part of the sample covered services. So that's another thing. You get all those different services, your eyeglasses, the bifocal, all that is able to be funded, and you get a discounted price. So again, Guardian having a great network, that's something you want to go with, and it's difficult to find outside of the Infinity program of products that's going to match, what they've done with the premium and the coverage that's available to you.
That's a great point. And keep in mind, and we'll talk about the flexible spending accounts next, but anything that you're paying out of pocket, we highly encourage you to use the flexible spending account. That's actually the next thing that we're going to cover. The flexible spending account, if you're not familiar, it's an account that you can set aside pre-tax dollars to help pay for those out-of-pocket expenses, whether it's a copay, prescription, eyeglasses, contacts, as Jason said. You can get reimbursed for it. The cool thing about this program is the IRS allows you up to, in 2020, $2,750 towards those out-of-pocket expenses. So if I elect $2,000 during my initial enrollment period, I get that $2,000 the day that I'm eligible. So most of these benefits, it's the first of the month following 30 days or during open enrollment. It would be eligible the first of the year. There is a $500 max rollover, so don't worry if you don't spend all your money. There used to be this use it or lose it plan policy, the IRS, but now they have a $500 rollover. So if I don't use all my funds by the end of the year, they're going to process my claims through the middle of March, and if there's a balance up to $500, they'll roll that into the new plan year. What's even better is that does not count towards your elected amount of $2,750. So in this case, I could have well over $3,000 to pay for some expenses. The other account is the dependent care. Works in the same fashion that you can set aside pre-tax dollars, but you cannot get reimbursed for what you haven't put in. So think about this: when you're electing these benefits, we're going to divide up the amount over the pay periods in the year. So if you're on a biweekly payroll, it's going to be 26 times. So just take that annual amount, divide it by 26. But what's cool, and what we're going to talk about a little bit later when we start talking about functionality of the system, it's all done for you. You don't have to think about it. It's all programmed into our system. So if I want to elect $500, I'm going to hit a calculate button. It's going to tell me exactly what my per pay period amount is. Jason, anything to add?
No, and that's all dictated right there on the platform when you go on and enroll, whether again you're on the self-serve model, it'll calculate the amounts and show you once you plug in your annual amount that you elect. The only thing that I say be sensitive to when you're determining the annual amount for your medical flex is just, look at your budget, look at what you spent in the course of last year, find out the exact number for that, and then that'll tell you exactly what you're spending and what your out of pocket is, and take in consideration your deductibles, co-pays, things of that nature, because that can also be exhaustive for this type of expense.
That's awesome. That's awesome. So the next thing we're going to really dive into is some of the voluntary products. Jason's going to walk us through some of these and really talk about the value that we've been able to bring. As Jason alluded to earlier, kind of our national partnerships with the likes of Kemper and Aflac. But Jason's going to talk about why they're important, the solutions. So Jason, walk us through what those voluntary products look like.
Sure, sure. So we're really excited, obviously, from last year because one great thing for all the employees here at Affinity, we're keeping everything the same. So that's nice. Everyone who participated last year, everyone who looked at these plans, we had such great price points. We got great underwriting from all our carriers. So we're keeping everything the same as it was. But the nice thing is we had a huge spike in participation. So even though we had a lot more participate, there's still, a lot of the population out there that have not looked at some of these benefits. So you get more choices. And then, of course, the need for the products, you get out-of-pocket costs, are increasing co-pays. Many of us have less financial safety net. One out of the ordinary occurrence can lead to financial stress or disaster. Is really the need. When something unexpected happens, these benefits pay dollars to you for the most part. You use that money however you want. So regardless what health insurance plans or plans that pay benefits directly to you, regardless of health care coverage. So if you have your own health care or you got health care through Infinity, doesn't matter. If you don't have health care, you can still participate in all these voluntary options. Use the funds however you see fit. Again, medical bills, rent, mortgage, use those dollars to pay any of your existing costs. Because what happens if you're out sick or hurt, your bills don't stop, correct? So that's what these dollars can be used for. And you can focus now on recovery and not finances.
Awesome, awesome. So here's just a snapshot of some of these benefits. Like I said, we've got Kemper, Aflac, Guardian, Term Life. But Jason's going to jump in and walk us through these benefits and talk a little bit about the guarantee issue. Keep in mind, this is not a full-on detailed explanation of these benefits, but just give you an idea as you get ready to enroll. These are options for you and your family. So just keep that in mind as we walk through these. And then again, once we get into the enrollment process, Jason's going to talk about, we're going to have counselors on, the call center for you to ask these questions.
So first, the Infinity employees and population had made heavy requests to get short-term disability. So we were finally able to get a carrier, and Kemper came to the table with a product that is really awesome. It's one of the most impressive voluntary disabilities that we see in the marketplace because it's considered guaranteed issue up to $6,000 a month. There's not another carrier out there that was able to match that. So that means at a higher income level, at 60% of your income is what you get paid if you're out of work for any reason. Now, there is some customization to this product. So if, budgetary standpoint, you can really customize this however you want. There's a couple different options. You can do benefit periods 13 weeks or 26 weeks, which basically is 3 months or 6 months of coverage, meaning if you're out for any reason, you elect 3 months, you're going to get paid for 3 months. If you're out for 4, 5, 6 months, then you want to choose a 6-month product. So then it'll pay for 6 months. But it is short-term disability, so it does cap out at that 6-month mark. But you make that decision, you make that choice. It also covers really any reason you can be out due to accident or illness. Also covers maternity leave. So if you're out and planning on having a child and your current company doesn't have any maternity program in place, this can supplement that and provide you 60% of your income while you're out for 6 to 8 weeks with childbirth, which is a strong benefit for you. Now, you own this plan just as you do any of the voluntary coverages, but if you own it and you leave Infinity or the company you're with for any reason, this is a portable program. Okay, so you can't take this with you. Now, the elimination period is the last bullet point, and that's just a waiting period. Just like any disability out there that you get on an individual basis or group basis, there's a waiting period before that kicks in. So simply put, 7 days accident, 7 days illness. If you're out for accident or illness, it's going to wait 7 days and then kick in. And then on that next week, you'll be getting paid percentage of your income on a daily basis for the remainder of the time you're out.
Great. And again, all of this is built into the system. You're going to see how this impacts the premium. If you choose an elimination period of 1 week or 2 weeks, it's going to impact the premium. There's no guesswork. It's all built into the system.
And that's a great point too, Ray, because once you're on with a counselor, they're going to walk you through those options. And based on your needs, could be age, could be your income, what you need may only be 3 months, and they'll determine that for you. So that's the nice thing about having that consultation.
Awesome. So let's talk a little bit about the accident. Everybody sees the duck on TV, Aflac, and this is exactly what that coverage is. So walk us through a little bit of what this is. What are some of the key features, some of the additional benefits?
So, many of us obviously have had accidents, right? Everyone has a history of some type of accident or a family member having an accident. And, when that happens, you could be out of work or there's costs incurred, right? Whenever you go to the hospital or emergency room, you typically have to pay a copay. Two, taking into consideration the fact that you had to leave work, right? You can't be at work if you had an accident. And this helps pay lump sum benefits, indemnity, paid directly to you, same as what your disability would pay. So if you have an accident, you go to the emergency room, you can receive up to $120 just for an emergency room visit. If you're confined in the hospital, first night is $900, and that money's paid directly to you, right? Most of your health care, depending on what health care you have, you probably have some out of pocket for that initial hospitalization or ongoing hospitalizations. This money's paid to you to help supplement that out of pocket and cushion that blow that you receive for the financial impact. And, that money can be used however you need to. If something happens to a child, that's very important too, because what do most of us do? We have to leave work and go get our child, and they have to go to the emergency room. Typically, we're taking them. So that indemnity can be paid for the whole family. Spouse may have a job where they don't have any financial protection. They can be covered under the accident as well. Nice thing with the accident, there's no health questions. It's guaranteed issue for anybody, anyone in the Infinity population. So it's a guaranteed issue for all. So, and again, you own it. It's portable. And their rate stability. There's no increase on the premium regardless how many times you use it.
Yeah, that's great. We're going to bring up a slide here. We're going to pause a couple seconds, just let you take it in. Again, like Jason was talking about, here's some examples of what are paid under our coverage. The emergency room, again, just a list.
Yeah, but we all know the impact of going into the ICU, step-down units, and all these things are very costly. So these dollars are paid per day that you're confined, in that situation. Hospital confinement, nice thing, if you look at that bullet point, is $225 per day, up to 365 days. So, I've had history where, individuals have been in the hospital for 6 months. They're going to get $225 a day per day in the hospital. This shows examples, a little girl on a swing, obviously gets a fracture, x-rays, fractures, follows up. That indemnity totaled almost $1,800. And then in a car accident, more serious, they got up to $27,000, almost $28,000 paid out. But then that person could have been out of work for a longer period of time, of course.
So the next one's a hospital, and again, this is through Kemper, and this is actually Aflac. Okay, so walk through the hospital benefit for those.
Hospital, very straightforward. Any hospitalization, whether it be accident or illness, you're going to get confinement, $1,000 for the first night in the hospital. Hospital confinement thereafter, $150 per day for a max of 31. ICU is $150 per day, and again, that pays right on top of the $150 confinement, so you get both of those benefits. Step down, $75. You also get a health screening, right? You get a health screening on the accident as well, as you saw for the initials, 15, and that increases every year. But the health screening for the hospital is 50, and that will pay on top of your other wellness indemnity by the accident as well. So all those plans are paid directly to you again, and this just shows examples of pneumonia, one stay in the hospital, $1,000, hospital subsequent, $150 a day. So they were in there for a few days, 6-day stay, $1,900. Now that's that could match a deductible for you, or if you don't have a deductible, it's still paying you that $1,900 to help with the days you're out of work. All right, critical illness with cancer. Now this is one of the most extensive critical illnesses products in the market. You can see all the bullet points associated as far as what covers and triggers that benefit. You get up to $20,000 guaranteed issue with this Infinity product for the critical illness, and that's very strong, meaning no health questions, no background check, evidence of insurability to get the 20,000. But you do have options. You can get 10 or 20. Spouse covered under 50% of whatever you elect. Children covered at 25%, and there is a $50 wellness. So if you have three products, accident, hospital, and this, you can get wellness benefits on each. There's also a reoccurrence benefit for this product. So if you are diagnosed and have a heart attack, you get 20,000. If you later on, 6 months down the road, have a stroke, you get another 20,000. There's not a lot of plans designed like that. That's a especially strong program that you can get continuous payout on that base amount. And there are no limitations for that. So it's an ongoing payout. Now, if you look at the asterisk partial benefit 25 and then the asterisk partial 10, things like Alzheimer's, as you can see, has an asterisk Parkinson's, muscular dystrophy be at 25%. But still, a lot of times those bullet points aren't even covered in most of the critical illness plans that we work with. So it's very expensive.
No, that's great, Jason. And as I pull up this slide, we're not going to talk about it, but I just wanted to reiterate the guarantee issue on all these voluntary products. You have it during your initial enrollment period, which means if you do not elect these during your initial enrollment period, that you could be subject to underwriting. So keep that in mind. For instance, if I were to elect critical illness for 10,000 during my initial waiting period or enrollment period, and then the following year I wanted to increase that to 20, I don't have to go through underwriting. So as long as you're in the program, you've met that guarantee issue during your initial period, you're able to get that guarantee issue in subsequent years.
And this gives a great example with the reoccurrence. You see the heart attack one's 20,000, heart attack two, another 20. So you see there's no limitation from another reoccurrence of one of those health issues. And that person gives up to 40,000. And then they also included the wellness benefit for the 2 years of $50.
That's awesome. So the next two benefits, what we want to talk about very high level, is a Guardian term product, term life insurance, and then a whole life insurance. What I want to speak about is the difference between the two. A term life policy is one that you're going to get a death benefit. In Guardian's case, you can buy a death benefit up to $500,000. The guarantee issue amount is up to $120,000. You can certainly elect over that amount. But you would have to go through evidence of insurability. That form is going to be available on the portal or via our counselor. But again, the term life is a face value amount life insurance. It's 100% portable if you were to ever leave your worksite employer or Infinity. A couple of other benefits are waiver of premium benefit. So if you're totally disabled, the policy is going to remain in place and you don't have to pay the benefit, or excuse me, the premium. And then there's the accelerated life benefit. Worst case scenario, someone's diagnosed with a terminal condition. They have a $100,000 life policy. There's expenses there. There's things that folks are going to have to pay for. They can tap into that accelerated life benefit. Couple of additional products. They have a will prep service. So if you need a living will or a trust, they're going to provide that to you at no cost. There's some other options like attorneys on retainer. There's small fees, but all of this information can also be found in the certificate of coverage that you'll receive after you elect coverage. The next one, again, is the whole life, and I'll let Jason talk about this a little bit more in detail, but the difference, again, between a term life and whole life is going to accumulate cash value. So, Jason, talk a little bit about the whole life.
And the whole life is a fixed premium, too, for the life of the product. So whole life, my comparison is term life's like renting a home, and whole life's like purchasing a home, right? You accrue cash value, you get equity in the plan. There's a permanent cost premium associated with the life of the policy. And, a lot of times individuals want to be able to have the whole life for the long haul, right? If something happens to you, you want the money of the beneficiary to get that lump sum of cash. So the nice thing about this plan, too, it's a bundled product. You can buy up to a guaranteed issue of $150,000 from your initial enrollment or eligibility, and you have an accelerated death benefit rider for terminal illness. Now, what that does is it pays out whatever you elect as a face amount. You get 25% of that up front if you're unable to perform 2 activities of daily living and you're admitted to a nursing home or assisted care facility. Now, the nice thing about that, you get that 25, and then you can then fund the cost associated with that nursing home, because we all know how expensive that is.
So, Jason, I elect $100,000 in coverage.
Mhm.
I am in my later years. I'm confined to a nursing home. You're saying I get $25,000 worth of benefit that I can help offset those costs. Is that right?
Offset the cost of the nursing home. Yeah, it's almost like a long-term care type of policy built into the life insurance.
No, that's great. That's
So,
great.
and then again, you have a dependent child term life rider. You can cover your spouse under this plan as well at 50% of your face amount. If you elect 100,000, for example, the spouse can get 50, and then you can cover the child under a term rider as well. So basically, have a full family coverage, something you can own. Again, it's portable, and again, you get equity in that plan and with the long-term care. So it's a pretty rich program. We've had a lot of popularity.
Awesome. So we're getting near the end. We've got about a couple minutes left, but we wanted to run through a couple of additional products that you and your family are going to have access to. The next one is Privacy Armor. We live in a world today where, private information is compromised every day. So this is a product that you can put in place for you or your family that's going to help protect you from dark web. It's going to help you protect your identity. And if you do get compromised, it's going to also offer benefits to help restore that. So, Jason, you want to add a couple of points?
No, I mean, personal experience, we all travel more than we ever used to. You're in different countries, different sites. You're using your information a lot more than we ever have. Phone information transmitted, all over the place. So the exposure is greater than it ever has been. Privacy Armor is one of the strongest companies in the marketplace right now. All the major blue chip companies use Privacy Armor, and they've had a lot of success. So you can see how extensive this is from the social media, which we're all familiar with, any financial transactions. They do complete audits. They can do wallet replace if something happens with your credit cards or anything like that. 24/7 privacy advocate remediation. So it's very strong. We've had nothing but positive feedback on it. So it is a very strong benefit for you. Well, and cost.
So the next one is a legal plan. This is a prepaid legal plan that's going to help for, if you need to go to court for traffic tickets, real estate matters, personal property protection. Again, another layer of identity theft matters, estate planning. So again, there's two basic levels here. There's a high and a low. Obviously, the high is going to provide a little bit more, but you can also have representation in court through their in-network facility or attorneys. So
yeah, they have a network of attorneys you can use. You basically have on retainer. You pay a premium just like you would any other type of insurance. But we all know, or if we've had a history of having to go to your own private attorney, it's not inexpensive. It's very expensive, and this just helps mediate that expense. You're budgeting for it, and you have attorneys all over the country that you have a network of. They do a very good job. They're all board certified attorneys.
So the next one is our benefit hub. I'm really excited about this. This is kind of our landing page in your enrollment guide and the information you received in your welcome email. This site brings you to not only our landing portal for all of these benefits, but it's also an employee discount program. So if you're traveling, you can buy anything literally from flowers to vacation homes. This is a free service to everyone that's part of the Infinity family. So we encourage you to go on here as you spend through various providers. You're going to accumulate cash values. There's daily discounts to restaurants, local restaurants, movie tickets, anything that you can really buy or you're consuming, you can get at a discount.
Yeah, it's just like kind of surfing the web for various services, right? Right. You go on
Yep.
and you find special deals on rental cars, the hotels, if you're traveling. It's actually kind of fun, and then just find out and discover how much money you can actually save on things that you do on a day-to-day basis. Like Ray said, they actually, if you look in at your zip code or geography, you can actually pull up restaurants, local restaurants that you may have favorites, and be able to get discounts and coupons for those various venues.
Awesome. So let's wrap this up and talk next steps. Now that I've gone through this, I understand the benefits. How do I enroll? Jason, talk to them about how they can get into the portal or contact our counselors to walk them through the process.
Okay, so this has always been, kind of the question, as we know that the Infinity family and the population is how do you take that next step? Well, the nice thing is, in a lot of the changes we made over the last year, we want to support you, right? We want you to be engaged. The better educated you are on these options, the better decisions you're going to make. So you can schedule an appointment with our Benefit Education Center. Go onto the link here at tinyurl.com and find a time that's convenient for you, regardless of what coast you're on, and walk through with a licensed benefit counselor and be able to make you an informed decision and walk through each of the different options as well as the premiums. You can adjust premiums, based on your needs. But we highly value, that experience for you, and it's a great thing to do. And if you decide not to make a decision, at least you're now logged into the benefit portal, know how to navigate it, understand it, and know what your options are.
That's great. Well, we certainly appreciate your time. We're here to help you, and we look forward to working with you in the future. So, Jason, I just want to say thank you for your time today,
I
and
appreciate it, and I appreciate everyone spending the time to listen to us today.
that's awesome. Great. Thank you, guys. Have an awesome day.
Right?